Inspired Spine is a total spine care provider committed to treating back and neck pain with the least invasive approach that's appropriate for your condition. They are raising the standard of care for the most complex conditions. And here with more is Dr. Hamid Abbasi, a neurosurgeon who's transforming spinal surgery and training surgeons all across the country in his revolutionary procedure. Welcome to Inside South Florida, Doctor.
Thank you very much for having me.
Absolutely, Doctor. Back surgery and back pain is something I know all too well. I've had 2 microlumbar discectomies in my lifetime, and I know that the recovery is just long and arduous. But you have been able to have people up and walking just 2 hours after a major surgery. How is this possible?
Well, it is possible because we don't cause too much damage on the way of getting there. We're not causing too much collateral damage on the way of going there. And you talked about microdiscectomy. Now, imagine 10 times worse recovery with a fusion where we take completely the disc out, put a spacer in, put screws in, and literally stabilize your spine, which is much bigger surgery. That surgery is prohibitively dangerous in elderly. And the difference between what we do and what's out there is if I can make your grandmother independent in old age or not, because even younger people, you still can do older open old-fashioned surgery, but we enable to make an 8-hour surgery a 1-hour surgery, and that sort of opens for people who are bigger, people who are older, people who have difficulties with other medical conditions, that the regular surgery is prohibitively dangerous, and they cannot have an open surgery.
So what you're saying is that the ideal candidate for this procedure is a myriad of people then, right? Not just young, not just old, but everyone in between as well.
The difference between the older and younger people is that older people cannot have, like an 80-year-old, 85-year-old person with lots of medical condition cannot have a scoliosis correction, which is 12-hour surgery and half a gallon of blood loss. We do it in 1 to 2 hours with a 200 cc of blood loss. We make it possible. For the younger people, the difference is if you go back to work 6 months after the surgery or 2 weeks after the surgery. That is the difference for younger people.
So recovery is a huge deal, as you said, 6 months to a year, depending on the age. But sometimes after these surgeries, myself included, they continue to have problems. Why is that?
And that is because in a macrodiscectomy, the surgery that you got, I compare it disc to a tire of a car. They patched your tire, whereas we give them a new tire. This is a more durable kind of solution for this problem because we are completely getting the bad disc out, and usually we consider doing macrodiscectomy because it's smaller surgery. Now imagine making a changing of a tire of a car as fast, as effective, as less risky and costly as patching it. So all of a sudden there is less reason to patch it, more reason to definitively and permanently correct the situation.
This is all, as we said, revolutionary because now we're seeing major advances when it comes to healing and doing these types of what are normally majorly invasive surgeries that are minimally invasive now. You're training surgeons across the country, though, Dr. Abbasi, and you're teaching them how to perform your technique. What advice would you give to them and patients who think this is too good to be true?
Well, look at the data, listen to 1,000 people that we have more than 1,000 testimonial people who have been told in major organization that they cannot have the surgery. If they get the surgery, it's a 2-day surgery with 2 years recovery. We do that surgery in 2 hours. They go home next day, and we have testimonials. This was too good for me to be true. And I want to emphasize this has nothing to do with superior skill of one surgeon. This is the different mode of transportation. For people who think it's impossible to get in 1 hour or 2 hours from here to Miami, they don't know flying. If you know flying, you know, but people who only know driving, they cannot wrap their head around what we are doing. It has nothing to do with me. It has all to do with the new procedure.
Right, and science. Wow, my mind is blown. Dr. Hamid Abbasi, where can they find out more information?
InspiredSpine.org give you all the information you need. And as a person who has a problem, this is 2021. All the information is out there, and the power is in the hand of the people that need this procedure, and they should just inform themselves. InspiredSpine.org, get all the information you need.
The power is in your hands. Dr. Hamid Abbasi, neurosurgeon with Inspired Spine. Wow, again, compelling, fascinating stuff. Thank you so much for hanging out today on Inside South Florida.
My pleasure.